Let's talk about sitting position of the dentist and assistant when you're working at the dental operatory. This is so important because if you practice for a long time, most dentists and assistants end up with low back and neck problems. If the dentist is right-handed, they'll often end up with a problem with the right part of their neck at the base of the skull, and then a back problem because they're bending forward like this. So the objective is to get in a position where you're sitting up straight and you're supporting your back with your stomach muscles. That's why it's a good idea to do some crunches or sit-ups periodically, because they say a strong stomach is one of the keys to having a healthy back. So let's talk about the best sitting position for the dentist and the assistant when you're working on a patient in the dental chair. First thing I always like to do is get the patient up in the chair so you don't have the wide part of the chair that you're having to get up to. You'd like to be looking down this way and not out this way. The other thing that I made the mistake of doing for a lot of times, I would have the chair too low, and so to use the rheostat I'd have to bend my leg in like this or like this. You want to get the chair up high enough that your legs fit under the chair and be in this position like this. Then the assistant wants to be sitting so their legs are about like this. So the idea is you're looking down on the patient's mouth and you're not out here either bending forward or having to strain your neck to bend like this. You want to be close to the chair so you're both looking down. So how is that for you, Louisa?
That's good.
You can get a little closer? Close as you can get. So her legs are turned like this and mine are like this, and I can look, and then while you're sitting, be sure you've got your back straight, supported by your stomach, and not slumping. If you slump, that's another thing that can give you back problems. So sit up straight, supporting your back with your stomach, and look down like this. Is that a comfortable position for you? So bottom line is her legs are like this, and my legs are about parallel to her legs under the chair like this, and then I can get to the rheostat without having to bend my knee or turn my leg like this. You want your feet to be straight up and down. So when you're working on a patient, I want the rheostat in a position that I don't have to bend my knee in an awkward position. I want it pretty straight up and down. And I want to be sitting straight up and down. Then when we're working on the patient, say we're working on the lower right, then I'm going to retract the lip and the cheek, and my assistant's going to retract the tongue. Now when she's retracting the tongue, she's not trying to pull the tongue away. She's just putting this mirror as a barrier between the tongue and the tooth, if you happen to not be using a rubber dam, so the tongue doesn't get into the operating field. Then if we're working on the left side, the assistant's going to retract the cheek and the lip, and I'm going to place my mirror as a barrier between the tongue and the tooth so the tongue doesn't get into the operating field. If we're working on the upper left, even if you're using a mirror working on the upper left, then the assistant is going to retract the lip and the cheek, and I'll be looking in my mirror, and I'm trying to keep my back as straight as I can and work like this. Something I find is very helpful is getting a larger occlusal mirror like this. It's easier than this small mirror if I'm not having to retract with it. And I'll place it like this and work. And most of the time, we'll place a tooth rest in the mouth. We call it a tooth rest. It's a bite block. And that does a couple of things. Number one, the patient doesn't have to strain to keep their mouth open. And the other thing, it steadies. We've got a small size and a large size. It steadies the patient's mouth so it's not moving up and down if their jaw gets tired. This way their jaw doesn't get tired. You can see this is a larger one, this is a smaller one, depending on their mouth opening. Now, if you're using the smaller one, many times you may not have enough room for the handpiece head if it's in the posterior part of the mouth. So I prefer this larger one. Before you start, put some Vaseline on the patient's lips, especially in the corners of the mouth and down here on the bottom. I'm going to place this over here. Now, Sharon, don't bite down hard, just let your jaw rest against that. Then we've got a very steady situation, so the jaw's not moving up and down, and I'll work right here. The issue with working on a mirror is it can get fogged up. More times than not, I'm working with a rubber dam on the teeth. I prefer that. Even if I'm extracting a tooth, I like to work with a rubber dam because you don't have to retract the lip or the tongue. The rubber dam keeps the lip, the cheek, and the tongue out of the operating field. Watch the video in Dental Minute, a quick and easy rubber dam technique. In that way, you eliminate the retraction by the assistant or by me. And if I'm working in this mirror, rather than holding a mouth mirror to retract the cheek or the tongue, she can have the air water syringe and blow air on the mirror, kind of hold it back and just blow air on the mirror so it doesn't get fogged. And if you've got the rubber dam in place, the mirror is really not going to fog probably very much because the rubber dam is blocking the patient's moist breath. Then if we're working on this upper side, we're working like this, we'll use these small single retractors to retract like this, and your assistant's going to have to hold this, so she really needs to be close to the chair so she's not bent over. And then I can look in my mirror and work, and if you're working on the top, you'll roll it up this way. Then you've got a good view right there, a good view of the surface of the teeth, so you can work on those. When you're aspirating, I'll be retracting here. My assistant will be retracting there, and you hold the aspirator in your, if I'm right-handed, she's going to hold this in her left hand. That puts the least amount of strain on her neck, shoulders, and arm. Now, Louisa, put that in your right hand and show how awkward that is. If you try to hold it in your right hand, number one, you pinch this lip all the time because it's always bumping that lip. And number two, this is really going to put a lot of pressure on your neck and your shoulder, and over time, you'll pay a price for that. So you want to put this aspirator in your left hand and aspirate, and that also frees up your right hand to reach over here and get instruments. The other thing is the assistant's chair should be higher than the dentist's chair because you're above and you're reaching for instruments, and just you're, from a view standpoint and a comfort standpoint, you want to be you're probably 6 inches higher, 3 to 6 inches higher than my chair. So that's the Dental Minute. These techniques work, and they work every time.
Take your practice to the top tier. Subscribe to dentistrymasterclasses.com for an organized library of all the Dental Minute videos, plus many complete comprehensive cases and many very important articles. New cases are added weekly, only $20 per month. Subscribe now.